The paper reports about whether or not the COVID-19 pandemic has affected physical and mental health of patients with congenital heart defects. We set up the study before the pandemic, and when the pandemic arrived, we didn't really know. We were a bit worried about whether or not the pandemic was impacting our study results. And that's why we set up a second measurement wave in Leuven, Belgium, Oslo, Norway, and Seoul, South Korea, to assess the patient-reported outcome measures and experiences a second time, 1 year after the first assessment that took place for all these patients took place before the start of the pandemic. The pandemic had a predominantly negative impact on the lives of patients. 61% of patients reported a negative impact on their overall life. There was also almost 10% of patients that reported a positive impact. What was a bit more surprising at first is that if we compared the pre-pandemic and the peri-pandemic scores on the PROMS and the PREMS at group level, the differences that we found were actually very small and were clinically negligible. We could not find any differences between PROMS and PREMS of patients who had COVID versus who did not have COVID. So why is this relevant? The findings of our paper reassure researchers who are currently investigating PROMS and PREMS in patients with CHD that it is very unlikely that the results or the data that they have been collected peri-pandemic outside of the first lockdown, that they are biased findings. And of course, also for clinicians, it is reassuring to know that the outcomes, the psychological distress, probably is again at the baseline level, at least when looking at these data on a group level.